Welcome to our 5 on 5. We're pleased to be joined by Cindy Mayo, the CEO of Providence Medford Medical Center. Cindy, good to see you again. How are you today?
I'm great. Nice to see you, and Happy New Year.
Happy New Year to you. And I know you guys have big plans for the new year. Tell us about your work in Ashland.
We're so excited. Starting in January, mid-January, we're opening up a physician clinic in Ashland with 2 well-established providers. They will be seeing primary care patients in that area at a new Providence site. And that site is on Highway 99, just on the edge of town. And so primary care will be there starting with 2 providers to continue their practice in the Ashland market. They were there previously. In addition to primary care, which is real important for creating a healthy community, we are going to have specialists going into that site as well. So going into that practice, rotating through, will be gynecology and urogynecology, women's health, women's health specialty. We'll have cardiology rotating in that clinic as well. General surgery will be there, as well as physiatry and neurology.
Wow, very good.
So some great access to very specialized providers in the Ashland community. We're really happy.
Yeah, absolutely, as you should be. Okay, now stepping back into last year a little bit, just real briefly here. Festival of Trees, it sounds like it was another smashing success.
It was wonderful. We had an incredible turnout. That event requires over 400 volunteers to help put that event on, which really involves the community. Very successful. We raised $489,000. So thank you to all the donors and contributors. Thank you to the community for that. We raised in sponsorships almost $130,000 of that. Most of that money will go towards a new Da Vinci robot, which will be the newest and best technology in Southern Oregon. It has a technology called Firefly, which means that when the physician's operating with the robot, you can actually inject kind of like a dye that highlights tissue inside the abdomen, kind of lights up, so that the physician has very good visualization of all the tissue. It's very advanced technology. We have the most experienced robot surgeons in Southern Oregon who've had over 1,000 cases done on robots here locally. So a good experience, good depth of physicians providing that coverage. Mostly urology, gynecology currently, but some advanced modalities we can use for that robot. So the money goes for that. We also had the Dr. Eric Overland Nursing Scholarship Fund that night. That fund raised $35,000 to train ICU nurses. So donors donated money towards education, critical care education, which was a fond area for Dr. Overland. So we're really pleased about that. It was a great event.
Oh, wonderful. Sounds like another very good success.
It was great.
Wonderful. All right, we're going to take a quick break. Much more with Cindy in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Cindy Mayo, the CEO of Providence Medford Medical Center. So Providence, Cindy, is doing a community health needs assessment. What exactly is that?
So we believe that part of our obligation to the community is to identify community health needs and understand what they are. We believe we're providing a great service, but there may be other things we've missed out on or could do better. We met with many local constituents, including mayors, the school districts, the police department, the fire department, and we actually did focus groups with the Latino population and the low-income population and seniors to see what they identified as the health needs that they need more help with. And so in that assessment, what's nice is that the leaders of the community and our focus groups all came forward with the same issues. One of them would be access to behavioral health and mental health. Better access. The other piece is addictions and how we treat patients with addictions and substance abuse issues. The other area we identified is access. How do you get access into healthcare? And I think with the new current healthcare plan, many of our residents are confused about am I enrolled? How do I get enrolled in a program? And so we heard those concerns as well. So from that health needs assessment, and again, thank you to our community leaders who helped us with that, and to our focus group participants, we'll put together what's called a Community Health Improvement Plan, a CHIP. And from that CHIP, we will look on those key areas of focus and then identify community partners and other ways of helping to meet those needs. So for example, addictions recovery is one, and we know we're partners with the Meth Project here,
right here,
and that will be a great partner to reach out to say, what else can we do? Education, prevention, and what are our resources to treat some of these illnesses. So the CHIP project will help us hone in, if you will, on those special areas that have been identified and put together a plan for the next 2 years on how we'll start working together with the community to meet those needs.
Oh, very good. Okay, now we're running out of time, but I want to ask you about some of the technology at Providence. You mentioned the Da Vinci robot earlier. You also have something else you wanted to talk about.
We have a great, brand new, so exciting CAT scanner, the most advanced technology available on the market. Wow. We will be the only hospital outside of OHSU in Oregon that has this technology. So this CAT scan is so advanced that it actually almost gives pictures close to an MRI type of clarity.
Wow.
The scans only take 1 to 2 minutes to complete. It is really very exciting. Our radiologists and physicians are so thrilled that this access for diagnosis is now going to be available. We should have it up and running probably by March. The equipment's here. We need to build the space for it.
Sure.
But the most clear, best CAT scan pictures you'll ever see. And you would have to travel actually to Portland to get that kind of image anyplace else in Oregon.
Very exciting.
We're exciting.
We're glad to have it down here in Southern Oregon.
Yes. We're opening up a sleep lab, diagnosing sleep disorders. That will be opening later this first quarter, as well as we've spoken before about our technology for cardiac catheterizations. We have very experienced physicians that can do cardiac catheterization work through the arm rather than through the groin, which is a great technology as well. So great things for our community as far as promoting and providing health care.
It's going to be an exciting year. Happy New Year to you. Good to see you again.
Thank you. Nice to see you.
All right. Stay with us. We'll be right back.